The world is still reeling from the devastation caused by COVID-19 over the past 2 years. As we enter a new era of rebuilding global health systems, the focus on TB and other lung diseases is waning, and those who need help the most are sadly the worst affected. The Union, the world's first international public health organization, is proud to continue the fight for lung health, and we thank you all for joining us from across the globe. Without further ado, we present the opening ceremony.
Distinguished guests and conference delegates, welcome to the 52nd Union Conference on Lung Health. I speak to you from Sydney, Australia, and I would like to begin by acknowledging the traditional custodians of the land on which I stand today, the Gadigal people of the Eora Nation, and pay my respects to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people and other First Nations people attending our conference today. The last 2 years have been a period of enormous change and disruption for everyone around the globe as we deal with the COVID-19 pandemic and its consequences. This year's conference was meant to take place in Canada. Instead, we are again meeting virtually. It is vital that we meet in whatever form possible to collaborate, share and act. We can only end tuberculosis and combat lung diseases if we work together. As the Union enters its second century, we want to reinvigorate our vision of a healthier world for all, free of tuberculosis and lung disease. The theme of this year's conference reflects that perfectly. Lung health for all, solutions for a new era. The conference will explore the challenges facing global health. With the world still in the grip of a lung health pandemic, it is also confronting questions about structural racism and how the same vulnerable communities that bear the brunt of tuberculosis and HIV have now been hit hardest by COVID-19. The World Health Organization designated 2021 as the International Year of Health and Care Workers in appreciation and gratitude for their unwavering dedication in the fight against COVID-19. I would like to thank all health and care workers for their selfless devotion to delivering excellent care in such unprecedented circumstances. It is an honour that Naomi, a nurse and MDR-TB survivor from Kenya, is alongside me today. Thank you, Naomi. You will hear a lot about tuberculosis and COVID-19 and the responses of scientists, clinicians, and affected individuals and communities from across the globe. You will also hear about other key threats to lung health: air pollution, smoke from forest fires, environmental degradation and climate change, as well as the scourge of tobacco, other respiratory infections, and the adverse effects of exposures to hazardous dusts and fumes at work. You will hear about better models of care for people with disabling and life-threatening lung diseases, asthma, COPD, and pneumonia. You will hear the important voices of affected communities in our open access space, Community Connect, where we will also be featuring advocacy videos and testimonials. It promises to be a diverse and exciting Union World Conference program. I'm happy to share that this year TB survivors and those affected by lung diseases have been given sponsored registration to attend the Union World Conference. I would like to extend a special thank you to our sponsors and partners for their invaluable support of the virtual 52nd Union World Conference on Lung Health. I would also like to express my gratitude to the Coordinating Committee of Scientific Activities, led by Dr. Carrie Tudor, and the Union's conference team, led by David Jackson, who have worked tirelessly throughout the year to bring you this online festival of new science, research, policy, and networking. I wish you all a successful, fulfilling, and enjoyable week at our online conference. Together, I believe we can end suffering from TB, COVID-19, and lung disease.
Your Excellencies, ladies and gentlemen, the COVID-19 pandemic has reversed years of global progress in tackling tuberculosis, and for the first time in over a decade, we have an increase in the number of deaths due to tuberculosis. So we have a reported 1.5 million deaths in 2020, 214,000 of these in HIV-infected individuals. We've also seen quite a big reduction in the number of TB cases diagnosed and notified to the World Health Organization. It's gone from 7.1 million in 2019 to just 5.8 million in 2020. And we don't know, there could be further drops in 2021 because we know that the pandemic continues to impact many countries, particularly the TB high-burden countries, and it has impacted economies, lives, livelihoods, as well as health systems. So there are an estimated over 4 million people with TB out there who are currently not being diagnosed. And you can imagine what the fate of these people is likely to be. So many of the deaths may not even be reported, and it could be a significant undercounting as well. We've also seen reductions in people started on TB preventive therapy, particularly amongst household contacts, including children. Now, of course, this is because of the disruption in essential health services, the fact that countries had to prioritize the response to the pandemic, putting all their financial and human resources into that, and also the fact that people had much less access to health services because of prolonged lockdowns in many countries. The one positive thing in this whole pandemic is what science has been able to deliver. And thousands of scientists across the public and private sectors working together have managed to develop a whole range of diagnostic technologies, including point-of-care testing, molecular diagnostic platforms, new ways of sample collection, artificial intelligence-based diagnostics, the use of mobile apps to track everything from doing contact tracing to following up people who are to come back for vaccination, the expansion of telemedicine and telehealth, the development of new antiviral drugs in record time, but most spectacularly, the development of all of these new vaccines, particularly using the new platforms like the mRNA, the DNA, and the viral vector platforms. We must not let this scientific progress be used only for COVID. We must leverage it to be used for TB and other big public health priorities globally. And so whether it's the use of new vaccine platforms for the development of novel TB vaccines, or whether it's the use of new diagnostic platforms so that every individual who has suspected TB gets access to a drug resistance test, this is the opportunity for the global community to come together and take this on in mission mode. Of course, what is also worrying is that the TB R&D funding globally is at $0.9 billion when we had a very modest ask of $2 billion per annum. We know that we've spent tens of billions of dollars on COVID R&D, and that's why we've been able to make this kind of unprecedented progress. So I would like to really call upon everyone, whether it's governments, the ministries of health and science and technology, industry, partners, academic partners, civil society, to really come together. Let's face this other pandemic that has been with us for a long time, the TB pandemic, with the same urgency that we showed for COVID. And I'm sure that we'll be able to make rapid progress in the coming years. Thank you very much.
In 2010, TB changed my life. I was working as a nurse in Kenya and experienced the suffering that TB patients go through. And then I contracted multi-drug resistant TB. My name is Naomi Wanjiro, and I've been working as a healthcare worker for 15 years, and I am a TB survivor. I'm honored to be here, having survived 2 pandemics this century. One that has taken the world's attention, COVID-19, and another pandemic that is silently killing 1.4 million people every year, with 10 million new infections. Yet the world has continuously ignored the leading infectious disease before COVID-19, and that is TB. Dear delegates, it is criminal that, while TB has been around for centuries, this curable disease is still killing millions of people. It is a shame that, due to complacency, the world is currently fighting 2 pandemics and shifting most of the resources to the newest infectious disease. My brothers and sisters in countries like India have borne the brunt of lack of political will and attention to TB, and this has resulted to mass stockouts and major gaps in TB care. The strain, despair, and loss of front healthcare workers like me could have been avoided. The commitment made at the UN high-level meeting in 2018 gave us hopes. Yet the report, Deadly Divide, Commitment versus Reality by Stop TB Partnership showed that targets are being missed. Today, we have gone back 12 years in terms of people diagnosed and treated for TB. I urge all the delegates to keep the promise made at the UN high-level meeting and invest in community-led TB responses. Each country should implement a TB response plan to mitigate the impact of COVID-19 on TB. Both diseases present with similar symptoms, and each person with a cough should be evaluated for both TB and COVID-19. We need to find high-risk asymptomatic group and test for TB, with follow-up treatment or TB preventive therapy for household contacts, especially children. TB stigma reduction intervention should be funded to ensure it is community-led, rights-based, and gender-responsive. A number of high-burden countries rely on Global Fund as their main financier. TB kills 60% of people across HIV, TB, and malaria. Yet the Global Fund provides only 18% of the funding to TB, when we really need at least 33%. We saw the political will at the ART-A Facilitation Council that raised 30 billion in 18 months, thus providing resources to contain COVID-19. Where was that money, and why was it not available for TB? Let us place TB at the center of airborne pandemic preparedness and response, and truly end TB by 2030. Thank you.
COVID-19 has further exposed the weakness of our health system. At the same time, TB continues to slip off the global agenda, affecting those most vulnerable. Human rights of people affected by TB are being violated on a daily basis. This needs to stop.
It has been 100 years since the birth of BCG. It shouldn't take TB vaccine developers centuries to do what COVID did in months. Secondly, household contacts, children and vulnerable populations are dying of TB unnecessarily. We have short-course TB preventive therapy. This is a human right.
There is a stock out of the newer MDR TB drug bedaquiline and delaminate. CFED refused to lower the price of the gene expert test. This is unacceptable. Fix the patent law. Medicine shouldn't be a luxury.
Без инвестирования в исследования, разработку вакцин, медицину и диагностику мы не можем ожидать эффективных результатов в туберкулезе. Но знаете что? Мы не прошли даже половину пути.
Le COVID-19 a mis en évidence la faiblesse de nos systèmes de santé. Malgré la disponibilité des vaccins, la plupart des pays, en particulier ceux à revenus faibles ou intermédiaires, continuent de succomber à des terminages d'otages et au manque d'accès aux vaccins, sans parler de kits de tests.
La llegada del COVID-19 dejó de lado la agenda de tuberculosis. Es necesario que todos, como comunidad, hagamos fuerza para evitar que nos dejen en el olvido.
La tuberculosis parece que no existiera, pero aún está entre nosotros, afectando a hombres y mujeres, sin importar su condición económica, su género, su sexo.
Los derechos humanos son nuestros desde el nacimiento. Y las personas afectadas por la TB no somos la excepción. No se puede coartar el ejercicio pleno de los mismos.
While recognizing that our demands from last year continue to remain a distant dream, we once again place before the global TB stakeholders our demands and will not accept anything less than urgent attention. Prioritize TB high on the agenda. Break monopolies to end inequalities around access to comprehensive TB prevention, treatment, care, and support. Invest, invest, and invest. Remove structural barriers. Since you started watching this video, 8 people have died of TB. When will this end?
Excellencies, distinguished guests, and members of the Union, ladies and gentlemen, it is my great pleasure to have the opportunity to say a few words at the opening of the 52nd Union World Conference on Lung Health. I would like to thank all who have made this conference happen during this challenging COVID-19 pandemic situation. I am also grateful for the numerous scientists and researchers who continue putting their efforts to fight against TB. This year, Union World Conference on Lung Health took the theme of Lung Health for All, Solutions for a New Era. This theme is very relevant to the desire of people to be allowed to live where they can feel safe and deserve, to reimagine a world free from any future airborne diseases. Today, I would like to raise 2 issues. First, the disruptions of TB services have become inevitable as a result of COVID-19 pandemic. Unless the responsible leadership gives their strong commitment to accelerate TB elimination, there will be a setback of the TB programs to 10 years behind. Second, there will be no way open to the world to be free from tuberculosis without the continuous support and effort from the government, researchers, international foundations and agencies, as well as community and international partners. During the COVID-19 pandemic, we were placed in a position in which we had either to accept or to defy. And we choose to defy. We carry out large scale of COVID-19 vaccination to make herd immunity to happen. In fact, we adapt our behavior to the new normal. We develop sophisticated research and innovation in vaccination, the same spirit we need to treasure and to achieve our target to ending TB. With its presidential decree on tuberculosis control, Indonesia have the highest political commitment in ending TB. There is no resting for any of us till we redeem our pledge in full to provide a world free from this ancient disease. There is no time for business as usual. We need to speed up our game because it is time to end TB. Thank you.
Thank you very much for this opportunity to address this August meeting. I take it really as an honor for South Africa to have been invited to come and speak at this very important conference. This conference comes at a time when we are faced with a global crisis like never before. The COVID-19 pandemic has sent shockwaves through global health, disrupted our economies, and also disrupted our livelihoods. Governments across the globe are overstretched in the efforts to contain the spread of the COVID-19 virus, while also trying to mitigate the impact of the pandemic on the delivery of health services. The need for partnership to address this pandemic cannot be overemphasized enough, and this should involve all players to ensure that progression of this pandemic is arrested and its consequences are reversed. As we are aware, TB is a leading cause of death as an infectious disease in the world, with more than 10 million people suffering from the disease and killing over 1.5 million just in 2019. This has been the case for many years, causing untold suffering to many families as it claims the lives of young people who are economically active and supporting families. Some of them are sole breadwinners in their families. Yet the world has for a long time failed to really come together to contain the TB pandemic. TB is still a major health problem, especially in lower and middle income countries, even though it is a curable and preventable disease. In addition, the COVID-19 pandemic has reversed the gains made in the response to the TB pandemic. The report released by the Stop TB Partnership in 2020 demonstrated that a protracted lockdown without service restoration will result in an increase in TB incidents and deaths to the levels last seen 5 to 8 years ago. This requires countries to urgently develop and implement service recovery plans. Our experience has been that as much as service has improved, we have not fully recovered from what we have lost during the COVID-19 situation, and we have not been able to recover to the pre-COVID levels of services for TB. This has been due to recurring waves of COVID-19. We in South Africa have just gone through the third wave. We have been forced to think out of the box, think of alternative ways of delivering health services, and especially explore the use of digital health solutions. There is a need, therefore, to ensure that TB services continue to be provided in a sustainable and accessible manner, even during the course of this COVID-19 pandemic. We also need to ensure that the poor and vulnerable are protected from the effects of TB, HIV, and other catastrophic impacts imposed also by COVID-19. More efforts need to be made towards strengthening the health systems and ensuring that they are better prepared for the future pandemics. Failure to do this will be a serious indictment on all of us. So we call on all nations to come together, work together with all other agencies, multilateral agencies, funding agencies, in terms of making sure we can add all our efforts in defeating TB as much as we have to defeat COVID-19. I thank you.
Thank you to all our distinguished guests for your important messages. The 52nd Union World Conference on Lung Health is now open. Thank you for joining us.